Hello. Today I'm going to talk about high blood pressure and why it's known as a silent killer. High blood pressure is also known by the term hypertension, which is defined as a blood pressure greater than 130 by 80 millimeters of mercury. Why is hypertension or high blood pressure silent but deadly? Well, it's extremely common. It affects 1 in 3 adults over the age of 25. The effects of high blood pressure can damage your body for several years before you notice any symptoms. So it creeps up on you and can cause major damage to your body systems if you do not control it. Patients who have uncontrolled high blood pressure will have serious consequences. Half of these patients will die of a heart attack, and a third have been shown to die of stroke if their blood pressure is uncontrolled. If they're not taking medicines and if they're not making lifestyle adjustments, then the risks are extremely high. This is a picture of a normal artery. Arteries are supposed to be flexible, strong, and elastic, but the effect of high blood flow and high blood pressure damages the arteries, so their structure changes and they are no longer flexible, strong, and elastic. You can see in the picture that high blood pressure damages arteries, which causes fats and other substances to collect in the inner part of the arteries, and this can cause blockage of the arteries. There is a reduction in the flow of these arteries, and this can have very dangerous effects on various parts of the body. Uncontrolled high blood pressure can cause parts of the artery to widen. These parts are weak, and these parts can rupture and cause death of the patient. High blood pressure can cause fatty deposits to gather and collect in the arteries of the heart, and this can block the blood supply of the heart. If the blood supply is blocked by a clot, then this can lead to a heart attack, which is a very serious situation and can lead to the death of the patient. The heart has to pump against a very high blood pressure if the patient has hypertension, and the heart muscle can become weakened and useless so that it cannot pump anymore. High blood pressure can cause damage in the brain through two mechanisms. It can damage the artery and cause a blockage, and it can also cause bleeding in the brain, which will cause a stroke and can cause serious brain damage. The effect of high blood pressure in the kidney circulation all the time can damage the blood vessels in the kidney and can cause the kidneys to stop working. High blood pressure can cause a reduction in blood flow to the penis, which can cause impotence in men and sexual dysfunction, which causes a great deal of distress. The high blood pressure in the vessels of the eyes can cause damage to the eye blood vessels, and eventually this can cause a loss of vision, which can be complete and permanent. High blood pressure causes a loss of bone mass. This is known as osteoporosis, and this predisposes patients to develop bone fractures. High blood pressure can affect your memory and your concentration, and repeated damage from high blood pressure to your brain can lead to early dementia. High blood pressure can cause sleeping problems as well as insomnia. This can have devastating effects on people in their day-to-day lives. Nowadays, hypertension is defined as a blood pressure above 130 by 80 millimeters of mercury. There are ways and means to control blood pressure. First and foremost, dietary changes, life changes, as well as the medicines that are prescribed by doctors. Dietary changes will include fruit, vegetables and whole grains, as well as nuts and fish in your diet. Lifestyle changes requires exercise. This is a video by Dr. Qurban Khan. If you want to get back to me with questions or comments, I've left my Facebook link as well as my YouTube link on www.tinyurl.com/Dr. Qurban, and Facebook is www.fb.com/Dr. Qurban.